suggest you guys get me on Facebook today.
Thank you. Okay, we're gonna call to order. Roll call. Please, Hagethorn.
Dr. Moore,
Yes.
Dr. Robinette.
Here.
Dr. DeGuzman, Ms. DeWitt, Dr. Gullidge,
Here.
Mr. Adamson,
Here.
Mr. Griffith.
Okay. Moving to item number 2, additions and adoption of the agenda. We'll need a motion.
So move. Second.
All right, roll call. I suggest a vote,
Voice
voice vote. All in favor, say A. Aye.
Aye.
Okay, and all opposed, same sign? Okay, motion carried. Okay. Moving for approval of last minutes on February 20th, 2025. Has everyone had time to review? Okay, so we need a motion to adopt the minutes as presented or modified.
So move.
Second.
Okay, all in favor, say aye.
Aye.
Okay, opposed, same sign. Okay, motion carries. All right. And so we have public comments. And on our public comments, Mike Steppen. Okay, do you want to come up and make some comments? And has 3 minutes. Okay. Hello there.
Hello, how are you? Is there a format or anything, or do I just dive right in?
You can just dive right in.
I just got off the highway.
Okay.
It's been a long 3 hours.
Okay.
My name is Mike Stevick. I'm a consulting engineer. The company I work for is called Rubber City Engineering and Environmental. It's out of Akron, Ohio. I've been a consultant for 30 years. I specialize in solid waste management. Tony Smith couldn't make it today. He's recovering from some heart surgery and 2 shoulder surgeries. He was planning on attending and called me on the way here to see if I could handle the meeting on my own. I'm like, I'm already on my way, so I'll do what I can. Anybody from environmental health? Are you Ms. DeWitt?
I am.
Okay. I'm the goofy guy that keeps copying my emails. Wasn't sure if there was a purpose to attend the meeting or if there was an agenda item, so I was told to attend the meeting. That's as far as I knew, so I basically prepared to come to the meeting and give an update. There was I work for a number of different construction, demolition, debris facilities and operations across the state. I was brought in by Mr. Smith from a client referral in February to help him address the license conditions on the 2025 operating license. So I've been working diligently on that, getting up to speed on the facility, getting information. Ann's been great to provide information. We've just scheduled a file review. I didn't know, I got 3 minutes. I can talk for 24 hours, 7 days a week. I'll do my best. I think at this point I provided an update to Ann and yourself, kind of a timeline, mostly to get myself up to speed in terms of, what are the issues? When did this get sent to him? And there's a number of issues that there was a stipulated deadline of June 1st. I'm running out of time already. I just realized it's my clock. Working towards those deadlines, I've gotten half of them basically accomplished, provided the fire prevention plan, provided the debris placement narrative. We've had the site flown by a drone survey. I'm working with that drone survey to update the drawing package That is a quandary right now because of the history of the site, trying to gather up what drawings are the accurate drawings for the facility. That's gonna be part of our file review. I brought on board another consultant, Egan and Associates out of Worthington. They specialize in groundwater monitoring and management for a number of facilities across the state. They're actually very well known. They were just put under contract today. Literally, as we sent the proposal, Tony signed them and sent them back. He's basically told me, do what I need to do to make everybody happy. And he hasn't put any boundaries on me in terms of getting that done. I can go into more detail, but I just ran out of time.
Okay.
How was that?
You did a fine job. You did a fine job. So I guess the question is, we had a time limit of June 1st. And so I guess we're just looking for an update on whether or not he's gonna be able to meet those deadlines.
Some of those, the June 1st deadline, I'd be honest with you, I don't know where the June 1st deadline came from. Had I been part of the conversation, I probably would have told you that's almost an impossible date to meet. Only the main one for that would be the groundwater monitoring, sampling, reporting, and turning that in. That's not normally, usually we shoot for the September 30th license renewal deadline. So by the time you get the groundwater sampling done, you get the lab reports, you do the review of the data and submit the data, you're usually talking a July or August timeline just for that. And really, I want Shay and her group to start off with reviewing the integrity of the existing wells. We have to review the data from the previous sampling events. The other concern I have, to be honest with you, is the hodgepodge of drawing files over 20 some years, is to try to put together not only what are the correct drawings for the site, because there's been a handful of different consultants over 25 years. And I have to take those drawings and develop an updated license drawing package using the updated aerial. I can do a lot of magic, but to try to get done by June 1st is very, very difficult. I'll just put it that way. Not saying that I'm not working towards the items on the bullet list. Like I said, we've some of them, the low-hanging fruit items I've already taken care of, but some of them are a little bit longer lead items than June 1st. Now, if that's what I can offer up, is to continue to give updates, to the timeline and our activities, in real time or weekly, monthly, whatever you want, to environmental health or the health department, so that you see responsible activity towards getting things done. That's not a problem at all, but it would be almost a sham to try to submit something by June 1st on these items. So.
Do we have any questions here?
What are we talking about? I have no idea what we're talking about.
Yeah, I kind of need more context too. I think.
Okay.
Yeah.
All right, so Zibby, you want to give us an update?
So the Springfield landfill, the construction demolition landfill that's located right here on Route 4. So each year they apply for a license to be able to accept that debris through us. And we run the program for the Ohio EPA, doing the inspections and enforcement of those rules. And we issue the licenses. And in the past, we have not received all of the required information. And Tony has been kind of lacking on getting us that information. So this year, when you guys approved his license to operate, you put conditions to get all of this information by June 1st on his license. Does that help?
Yes.
Okay.
I remember that.
And he has a second site, correct?
He does. He
Yes.
also has the northeast landfill, which is up on Mahar Road, but that one is not open. He licenses it every year, but is not currently
Not
accepting
accepting.
any waste there.
So we're just talking about the one out here.
The Springfield one on Route 4. Yes.
So what I might suggest is that you provide what you think the most realistic timeline is for every single thing on that requirement. Provide to Zibby, we can provide it to the board.
Yeah.
And if between now, when you do that, and next board meeting, if the board feels like you'd like to see that on the agenda, we can plan for it.
Yes.
Yeah, and I'm happy to come down for any meetings, have Herschel calls, save a drive. Anything that you basically are after. I do work as a consultant for industry, so I don't really work on the other side. But if you want, I can give you references to other health departments and stuff that I am directly working with, and I've been working with OEPA folks that I've been working with for 20-some years to give you an idea of who I am and what you're dealing with me and Shay with Egan, to give you a comfort level. But it's basically a tidying up activity is what needs to be done, but I'm literally getting up to speed in the last 3 weeks on the site, so it's not something, I don't really want to rush it. I shouldn't say that. I'm not gonna drag my feet, but I also don't want to rush it and do it, and end up with lots of back and forth comments or missing some historical confusion, so.
All right, well, we do appreciate you bringing this information forward. Chris, I think your suggestion is a good path for us to follow, and we'll put it on for next meeting. Okay, thank you so very much.
I'm gonna drop off some business cards for you. Am I allowed to walk past this?
Yes.
Don't want to end up on YouTube.
Okay. You will.
Great.
Okay.
Do you want me to stick around for anything? Any questions or anything
I
afterwards?
think only if you want to stick around.
Yeah, no.
Are you driving back to Akron?
I was thinking about going to Columbus, but I may just.
Okay, all right.
Anyway, it was a pleasure meeting you all. I didn't know what to expect. Hopefully I gave you a good update, and, feel free to reach out on anything.
Thank you. Okay. And next on our public comments is Douglas Kurloff.
You just want, that was, he's on the agenda, 5A.
Oh, okay.
So you could just roll right into that. We can also pretend you said 5A.
5A. Okay. Wow.
Thank you, Dr. Moore. Board. So I'm here to happily report that the system at 939 Spruce is fully operational, completely rebuilt. So I got a nice little hot rod there right now. But thank you for your patience and working with me on that. It does highlight a lot of other issues though that kind of noticed through this. I mean, every system in my house, component and so forth, appliances and that, I can go to a Lowe's, Home Depot, any hardware store, find a component, work on it, fix it myself, whether it's gas operated, electric and so forth, except for septic system or aeration system. So that leaves a homeowner kind of in a pickle in the sense that there's dozens of manufacturers that produce probably hundreds if not thousands of different systems, configurations of those systems and so forth, and each of those, the instructions, the parts, are all proprietary. So then the contractor that allowed to work in it obviously is then licensed or certified by that particular manufacturer, have their own little districts and their own little areas, for sales and installation and management. So then they turn around and charge the homeowner hundreds of dollars every month or every year to come out and service the thing. Don't know whether they're doing it or what. You're kind of beholden to that. And the perception then too, for the homeowner's perception and talking with other people in similar situations, is that they become the criminal because it's their property, getting served the notices and so forth. That kind of the perception abolishes this mafia of these manufacturers and providers of perhaps their responsibility of that too. And I think that's, kind of been a problem. So again, patience for working with me on it, and her training is fantastic. Let me tell you, it's probably the only way kind of could help people through, but a lot of people don't know that they're there to help, I think, because it just seems like getting slammed with the notices. And I understand the rationale behind that, but there's a lot of smart people working here and in her office that I think there is a solution and possible solutions to how to kind of stop having the citizens here, getting court fees, all this other stuff that then results because they're tied down by, paying the hush money to somebody who's gonna give them protection, right? That doesn't always work out. So, we all know when we got our first cell phones and repeated ones, everyone had a damn proprietary cord. Now they're standardized. I think there are opportunities for that too, whether it's enforced or whether, mandated by you guys here at the board or by the county. I think they're opening up the proprietary little monopolies of only letting one guy operate and install. I think some of that's been broken down a little bit, but from that aspect, I could do it myself. You could do it yourself if you walk into the hardware store and get the piece or parts you need, but we're not there. And so, again, thank you we're there, and I think I'm going to continue to explore this with her and her team as how to break some of that down so that maybe the homeowner can do a little bit more, so forth. So, yes, I will get that license, and yes, I will be working with you guys. So moving forward, I am going to have them come out. I'll pay the money for them to come out and validate that, until we work out and just make sure everything's going right now, running perfectly. And then I'll get my letter here in a little bit, and I'll pay the fee to have the staff come out and look at it. But then we'll move on from there. You guys be seeing me more often. Thank you.
Thank you for the update. Okay. So no action needed on 5A. Thank you very much. Mhm. New business, food service operation license suspension. Mr. Wood.
Thank you. So tonight, we're bringing before you a retail food establishment to consider suspension of their food license. So back in June of 2024, we went to the facility on a complaint, on a standard inspection. And while we were there, we noted several live cockroaches in the facility and many products that were not labeled properly. So no label whatsoever. Things like loaves of bread, little nut clusters, fish, meats, spices, had no labels whatsoever to tell us what they were. So we completed several re-inspections over the next 6 weeks, where we finally saw no evidence of live cockroaches, and we finally got them to the point where they were labeling all their food product. The week after that, we received a complaint that they had cockroaches. Went back out, and again, there were cockroaches again. So over 6 months, we completed approximately 10 re-inspections, and each time we'd go out weekly, we'd start to see progress. We don't see roaches, we've got things labeled. So we say, okay, we'll be back in a month. We go back in a month and there are cockroaches again and items are not labeled. So it was just a continuous cycle of that. So tonight we're asking you guys to consider suspending or I guess revoking the food license at Creation Market.
Okay, we have item 6A before you, and we will need a motion.
Seconds.
Are there questions?
One point of clarification on that resolution. The way it reads, it says a resolution suspending the food service operation license. That should be retail food establishment license.
Retail
It's
food.
more than semantics. It's in the law. Your restaurants are considered food service operation license under the Ohio Department of Agriculture. Grocery stores, convenience stores are retail food establishment licenses under the Ohio Department of Agriculture. So it's the difference between health and agriculture. But it would matter in court, truly.
So it will be the modification for retail food
Establishment.
establishment.
So it's not a restaurant?
It is not.
It's not, okay.
It's a market. Convenience store.
It's a market.
And I'll also offer the way the resolution reads, it reads very similar to what we did with another facility last year. A minimum of 2 weeks suspension, delegating to me the discretion to extend it additional 2 weeks if improvement is not seen. That's what we did with the previous facility.
And I can tell you today, I sent staff out today, there were no live cockroaches today. A couple dead ones, but there were multiple food items that did not have labels on them. Fish, spices, beans, and that was all today.
Are any of your inspection reports in our
They are
package? I'm
not.
just, like, because I didn't see them.
Yes, I'm sorry, I did not put them in,
Okay.
in your packet. We can pull
They're
them
all
up.
online.
Do you want me to have?
They're all online, if you
They
didn't
are?
know that, so the public can view them too.
We don't need to pull,
Okay.
well, I don't need you to pull them up,
Okay.
someone else might. want to. But I was just wondering if they were in the back or something.
No, you did not miss that one. Same, pictures weren't quite as impressive with this one. As they were last time, so I also did not put pictures in your packet. We do have some if you want to see them, but
Any questions?
So you've basically just been back and forth since last June.
yes. And the facility opened like maybe 6 months prior to that.
Okay.
Yeah,
Do
maybe.
you- So they don't really seem very cooperative just until they think they're under the radar, seems like to me.
Yeah, I think they kind of, I'm not sure what it is.
Maybe education,
We
Like
have,
the Safe Food Handlers course or?
something like that.
so they have not taken that. Can I share? Okay. It is a ethnic market. They are Haitian. She does speak good English. She understands. And she has even said, like, I don't want to be in trouble. So I don't know if I don't know that so much that it's maybe, it might be more education on her training her staff. On doing things. She does have a pest control company. She has shown us reports. But somehow we're still seeing, I don't know where they're coming from or how they're coming in. But like I said, it's odd because we won't see them till we go a month or so, and then all of a sudden we've got live cockroaches again.
Yeah, with encourage maybe another pest company. I don't know the life cycle of a cockroach, but,
Did they ever die?
but
Well, we have found some frozen in the freezer, so those were definitely dead. But
It's as much about the breeding cycle
yeah, that's what,
and disturbing the places where they hide and reproduce. So
yes.
I'm suggesting the way that you did it with the restaurant last year, I mean, that education is included in the ServSafe training.
Yeah.
And I would think that you would want to put some teeth into the training, that unless you go through the training, because they will not, they will learn the properly, cleaning and rotating and labeling and all of that as part of prevention, keeping the public safe. So that's a part that I would recommend in this.
So they have not completed the safe food handling?
Mhm.
And so we recommend that that's a stipulation in there?
Yeah.
Okay,
I can say that
Yeah.
for many, many other restaurants, they understand that this is the law, and that you can close them if you don't have a trained, licensed, or certified, trained person in charge in the building.
how long does it take them to complete the training?
So there's two different courses. There's a manager's food safety training, which is a 16-hour course, and there is an exam with it. Here in Clark County, the OSU Extension Office provides our food safety training. And she has, I believe, 4 of those classes throughout the year, and they're 2 8-hour days a week apart. There are other places in the state that you can also take them. I don't know if they do theirs 2 days back to back or how they do those, but it is 16 hours. And then there is a food handlers certification, which is about a 4-hour class, which is also taught by OSU Extension here in Clark County. And they're also both available online. The manager's level though, has an exam and it has to be proctored by an approved proctor. So they would, if they wanted to take that one online, they would have to like coordinate a time with OSU Extension to go take the exam in their office.
And you said it's offered 4 times a year?
At our OSU Extension here in Clark County, but there are other resources and places that they can go to other counties. Champaign County has it, Greene County offers it, Montgomery County offers it.
So we
The last facility we did, he found another place here in town that came to like one of the hotels that came and did it, so he did his through.
So we can include that and that we want them to.
That would be within the 2 weeks.
I was
That
gonna say,
seems
that
like
No,
doesn't seem like
I
it's
think
gonna be
we'd have to
within the
give
2
them-
weeks. Okay,
Yeah,
but they can get it scheduled
They can
probably.
get it scheduled. Absolutely.
Have they been offered that or told to complete that in the past?
We let all of them know when they come in and license that it is a requirement.
Okay, but they are not given a time frame for when they have to complete it?
It is, if I remember correctly, is it on a part of your inspection report?
It
And
is.
you do note it every time you do an
Every time.
inspection that it's not been completed. So they do get notice that you're aware that it has not been done constantly.
I was just thinking of the language, potential language barriers, even with the labeling of food, so it would need to be in multiple language, I mean,
So when this facility licensed, we worked very closely with her to get the labeling done. We provided her with an example of a label and exactly what all she needed on it. She does have the labels, and most of the time when we go in, she pulls out the roll of labels and shows us that she has them. It's just that they're not getting put on the product consistently. Another thing we've worked really hard with her on is when she repackages, so she'll buy fish in a big bulk and then repackage them into, maybe 1 or 2 fish in a bag, is that when she puts that sticker on her bag and then puts it in the freezer, the sticker may not always stay attached to the bag. So we've been trying to work with her on figuring out an alternate way to make sure it
Label.
stays attached to the item.
Good challenge.
Yeah, what education. Okay, we have discussed this and we've asked to have it included that they will need to complete
Schedule.
That's right, schedule because it's 2 weeks. Schedule the safe food handler for the manager and the food safety for the handlers, okay? And if we can provide them a list of, that would be great.
Can I also ask, are they aware that this is on our agenda tonight? I know that last year that restaurant was aware.
Yes, they are aware. So right around the time of the last month's board meeting, we delivered a letter to them, hand delivered it to them. That letter gives them 15 days to request an appeal hearing. And then we have 10 days after that to respond to them. And they did not request anything, but they did know it was tonight, yes.
Zibby, I forget what the law or what the code is, but is there just the requirement to have one licensed person on duty at all times?
Yes, so
And
depends on the risk level of your food facility, but yes.
would it be a stretch to require them to have every employee, go through the 4-hour handling? Is that a hardship or not?
No. But is that what the code requires? Just wondering.
It's not.
It's not.
I don't think that's required of any
One.
other.
Yeah.
So the manager's level is 1 per facility, someone who has managerial or supervisory responsibilities. And with the intention that they're there on a somewhat regular basis. And then typically one person with basic food handling per shift.
So they could have the same struggles that other people have that are in food turnover.
Just because I'm trained doesn't mean the people doing my
Right.
work are gonna do the work. I mean, there's a couple problems there. Right? So,
And I will tell you, when we go in there, it's normally the same person. You know, we normally see the same one or two people, if not seen every time we go in there. It's not a new person, or there's, you know, 20 people working in there.
Small market,
Yes, very small.
or family owned, I'm sure.
Yes.
Okay, so we have resolution suspending the food service operation license for a minimum of 2 weeks, with the caveat that it can be extended, as we did with the previous business list. But we are also asking for them to know that they have to be compliant with the food handling managerial training needs to be scheduled, and the food handlers 4-hour training needs to be scheduled, and we should know that at the end of the 2 weeks. Okay. So then I guess my question is, at 2 weeks, you go back and do an inspection. And we find that things aren't labeled and stuff, so we then are extending this.
For up to 2 weeks.
We can't for up to 2 weeks.
Authorized.
It just, yes, discretion, I mean, I'm sure I'll go out with you and your staff like I have. I've been to this market with the staff, it's been a while, but, yeah, it just depends on what the progress they've made, and just using our discretion as sanitarians.
Okay. All right, so we have a motion. So a second?
One final question, just a clarification. We are going with, they need to be able to show that they have scheduled these trainings, but not show that they have scheduled the trainings for everyone who works there. Did we go in that route? I just want to make sure I know.
I don't think that we require it for everyone. Okay. I think you said that it has to be at least one person there per shift, and the manager, okay.
Is working.
So it'll be up to them to make sure they schedule employees appropriately.
So as an example, if a facility has 4 managers and all 4 of those managers have taken the manager's level food safety training, they don't have to have someone with that basic food handlers training.
Okay.
Does that make
Yeah.
sense?
But if I don't have a manager working there that day, I have to have,
Yes, the basic food handler.
that helps much. Okay. Scott, you're probably the only one who knew that.
The person, the part-timer, that is not following procedures, to go ahead and take that training too, you know? But if there's only one manager in that whole market, I would say multiple trainings should be enforced. But that was a good point, that a restaurant that's open, say 7 days, has 4 people, there's almost always gonna be somebody trained in the restaurant, so I'd say leave it to your discretion.
Thank you. Are we ready for a vote?
Yep.
Okay.
One more thing.
Yeah, one more.
I'm hoping back, I am hoping back.
Me too. So. We'll take that.
All right,
Okay.
I always have. So,
Dr. Moore,
yes.
Mr. Adamson,
yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes,
Dr. Gullidge.
Yes.
Okay, we have item 6B, sewage variance request. Mr. Witt, from food to sewage.
Now we're moving to sewage. So this is a variance from the required isolation distances. This property needs a replacement septic system, but due to the challenges of the lot, they are unable to meet the required isolation distances. And this one is not in the packet on your tablet. It's the one that was linked. Yes, that's the one. It was laying off to the side. So, Ohio Administrative Code requires that all components of a household sewage treatment system be at least 10 feet from a building or structure. In this case, you have two drawings. One is hand-drawn from the septic installer showing where they are putting their, it's on the back side of the, like, there you go. So it looks like this. Showing where he's putting it. I printed out the aerial so you can see the lot is a very triangular shaped lot. So the septic system is here. So their current tank is here to a dry well. Because of the constraints of the way the lot comes, the installer is going to install the new aeration system between the house and the current tank, and he will be 8.5 feet from the house. If you tried to move it down here farther away from there, then we're hitting distances from both property lines, because we have to be 10 feet from property lines. And we would not meet it, even be close, because from property line to property line down here is only like 25 feet, and we have to be 10 feet from each of them, and tanks are longer than 5 feet, so.
Where does the aeration flow to then from?
So he is going to, so it's gonna be an aeration system, and it's going to discharge into the current dry well. Just
Okay.
because there is no good place to put it.
Right,
There's no
Okay.
roadside ditches, so this is Lower Valley Pike.
okay.
The river, Mad River's right here, down
So
here.
help me understand what a dry well is. Is it like a French type?
A dry well is a big hole dug in the ground filled with sand or
So
gravel.
it's like a French drain?
Yes,
Okay,
but a big
Right.
square.
massive, yeah.
Basically takes your sewage treatment that is normally
Right.
horizontal.
And takes it vertical?
Yeah.
Okay, so it's sand, different sizes, gravels?
Yep.
Okay,
Yes.
and the maintenance of that is just like a leach field then? Really, it manages itself or?
Yes, so, we're not, I guess I should say, we're not exactly sure the condition of this dry well, because that was their secondary leach system forever. But we're putting in a discharging system, so that's approved to be discharged directly out to the surface of the ground.
But there's not.
But there's not a
discharge
good
to-
place to discharge it to. There's no roadside ditches, there's not a creek. We don't really feel that it's just like his.
So an engineer, they'll tell you a dry well, it's basically a big hole that holds water until the ground can absorb it.
Sure,
Yeah.
it's like French drain is
Yep.
what I
It
would
is
call a
exactly.
French drain.
We didn't want to push it towards the railroad right of way, either. So if the dry well's like, I'm not gonna absorb water, it's going to discharge like your sump does. It should, as long as the aerator's maintained
Just discharge. out to
clean
the
water, and it's
property.
just gonna discharge out and absorb into the yard.
Okay,
Does that?
yes, thank you.
And they have no other place over here that they could put it?
No, so the well is up in here, and we have to be 50 feet from the well. This over here, this part over here, they've installed, it's not on here, but they've installed an above ground pool over here. But even if they tried to do it, there would be lots of rerouting of plumbing to get it coming out of the house this way to this way, even if they didn't have a pool. So this side yard here is no longer available. It's
It's not on
the
that
the
area.
pool is not
Trampoline.
on here.
Oh,
Yeah, there is a
that's-
trampoline
Yeah.
over there.
So the variance is for 2.5 feet is what I.
Yes, thereabouts.
Okay.
And are there any risks? I mean, obviously there must be some risks, but are there anything we should know?
I don't think there would be a huge,
The closer you get to a building, if you have to have maintenance done, you just run the risk of damaging your structure.
Yeah.
But they signed a hold harmless
They did.
agreement with a variance like this.
And is there a property immediately adjoining this?
no, so this way here, comes to a point, the road keeps coming this way. And so there's no other like houses or anything this way. There's just this house over here. And then, I
This
don't
is
think
across
there's
the road.
houses across the road, directly across from the road.
Okay, we have sewage variance fee for you, for a variance of approximately 2 feet. We need a motion.
So
Second.
Any additional questions? Ms. Hackathorn?
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Gullidge,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith.
yes,
Okay. Item 6C, tagging out equipment in food services listed.
Thank you, Dr. Moore. So this one is, kind of an addendum to a previous resolution. But back in September, there were amendments made to the Ohio Administrative Code 3701-21, which are rules for food service operations. One of the updates was the adoption of a rule to allow local health districts to tag equipment in food service operations using procedures for cease use in the Ohio Administrative Code 901 3-4-12, which regulates retail food establishments. So we've always had the ability to tag equipment in a retail food establishment that may not be working right, to tag it to not be used. We never had that for food service operations. So when they updated the code, they put it in that we could now tag equipment in food service operations. So in 2003, the board passed a resolution giving the health commissioner and, at the time, assistant health commissioner, now deputy health commissioner, authority to enforce the section of code on your guys' behalf. So tonight, we're just asking to update the resolution to include OAC 3701-21, which allows us to tag equipment in FSOs.
We have a motion before you for tagging out equipment in food services operation.
so moved.
Second. Do we have any questions? Do we need to actually put those numbers in that Zibby just nicely rolled off?
There
To
is,
us.
so you have a short version of this, there's
Yeah.
a longer version in your packet
Mhm.
that meets all the requirements of the Department of Agriculture and the Department of Health.
Okay,
They need all the whereases and therefores and
and that's included in the longer version that's on there, okay. Any additional questions?
So it's page 35.
Page 35, you can read at your leisure. Okay. Then we'll go ahead for a vote.
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Dr. Gullidge,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith.
Yes,
Okay. Item 6D, contract renewal for Dr. John Dobson.
Thank
Ms.
you.
Hanover.
Thank you. We would just like to enter into a contract again with Dr. Dobson to be the provider for our Community Health Connect Clinic, or what was formerly the Refugee Health Clinic.
Okay. We have item 6D before you. And we need a motion.
So moved.
Second.
Any questions? Roll call, Ms. Hackathorn.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
yes,
Dr. Gullidge,
Yes.
Dr. Moore.
Yes. Okay, item 6E, return check fee. Mr. Cook.
So we've got, in the last couple of months, we've had a couple of bounce checks written to us. You know anything about, hopefully you don't know anything about bouncing a check, but if you do, there's a charge for that. And the county treasurer charges $10 for a bounce check. We don't have anything on the books that allows us to pass that along to the person who bounced the check. So guess who's paying for it? the general fund right now. So I'm simply asking for a resolution that allows us to say whatever the fee is that the county treasurer is charging for a bounce check, not setting a fee, right now it's $10, but if they change it to $20 next month, because the way this is written, we're just gonna follow whatever they have, we can pass that along to the person that wrote the return check. To do this though, since we're setting a fee, there's a section in the code that says if we want to make this effective immediately, we can pass it by emergency resolution. I'm not sure if anybody's been here since we've done one of those. Typically, we don't like to do that. We'll do the 3 readings. But if we do 3 readings here, that's 3 more months of potential fees that we're going to incur when it should be the person who bounced the check that's incurring that. So this is, if you're entertaining this, it's a 2-part motion and resolution here. First, you have to dispense with the additional readings as outlined in Ohio Revised Code 73117. So you would have to have a roll call vote to dispense with additional readings. And then, once those readings have been dispensed with, you would have a roll call vote to adopt the resolution as written, allowing us to pass along the fee that we're being charged right now to the person who has bounced the check. Questions?
Yes. Why do we accept checks? I mean,
Well,
I was
Mike,
at
it's a
the
great
sheriff's
question.
department and it was a cashier's check or,
Yeah.
you know,
That's a good point. So about a year, we made a couple of adjustments. It was about a year ago. About a year ago, we used to accept checks from out of state, out of county, out of everywhere. We kind of reined that in because we were getting some bad checks written from other states, other places, even other places in Ohio, right?
Yeah.
So right now, our policy is if you're gonna write a check, a personal check, you gotta live here, right?
within the county.
Yeah, you have to live here. So we reined that in, and that made a difference. Suddenly, we weren't getting checks written from Minneapolis that are getting bounced, right? So we reined that in, and this is, I think, the first time, maybe not the first time. We haven't had a lot, but the reason it happened recently is it's food license renewal time. And poor Jackie in Environmental Health gets like 1 billion of these a day, renewals coming in, getting a lot of checks, and all of a sudden we're like, oh shoot, there's a bounce check. Oh, there's another one. And so we got to looking at it and saying, okay, well, these are corporate offices, or they're, well, actually these examples were not corporate offices, but like if you, to your point about who writes checks, corporate offices do.
Okay.
You know, if they've got, 3 facilities in this county, they write a check for all of them. So I want to continue to accept checks because the alternatives, yes, cashier's check is an alternative. If they have a card, we pass the fee along to them. And I mean, some of them don't want that fee, they just would rather write a check and I won't take that away. But if it bounces like a rubber ball, then they got to be responsible for it. So.
Okay.
But going the route of a cashier's check is maybe we don't want to do that, or we haven't done that because it's too much of a burden, or what's the?
Yeah, I think, and
It is a
Money
long
order.
time doing it.
Cashier's check or money order.
for some of our mom and pops and our mobiles and our small places, that is going to be a bit of a burden. I think what we do is by passing this along, it does put that responsibility back on them. I mean, if you want my recommendation, I would not recommend only accepting cashier's checks or money orders unless we get into this period of time where we just have so many happening.
I mean,
Two in the number of that we've received. Yeah, I don't want the county, us paying $20, but that's maybe 1% or less, probably less than 1%. Think about how many hundreds of,
700 to 800.
okay, that's way less.
So-
Well, that's how
Alright.
many food facilities
Right.
we
But how
license.
many
Some of them
check
will
is
write
money
multiple, one check for multiple facilities.
check.
$1.50 versus.
the fees they have to pay to us and their bank, but money order, saving money. Yeah, so no other questions.
So our first motion is to dispense with the additional readings of the fees as outlined in ordinance 731.17.
So move.
Second.
Okay, roll call. Ms. Hackathorn?
Mr. Adamson,
Yes,
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Gulich,
Yes.
Dr. Robinette.
Yes.
Okay. And then, the second part of this is to adopt the resolution.
So moved.
Second.
Okay,
Can we ask a question before we do the,
yeah,
So,
you can.
just so I know that the wording is we're setting a fee equal to the fee charged. So we're not technically passing along the charge, although in practice that is what it is. Because of the language of this motion, that means the setting of the fee is on a sliding scale in the future if that fee charged by the treasurer's office changes?
Yes.
Okay.
Yes.
Good question. Any other questions? Ms. Hackathorn.
Dr. Robinette,
Yes.
Dr. Gullidge,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Mr. Adamson.
Yes.
Item 6F, annual report acceptance.
Well, in your packet, you've got what we tried to do again this year is make an annual report that's interesting and makes you want to look at it. I don't know if you've ever read an annual report of an agency that you're just, again, if you have trouble sleeping, maybe that's your solution. But we tried to make that not our annual report. You have a couple of responsibilities in this. First, it's just to accept it as a true description of some of the things that we've done this year. And then second, basically direct me to deliver it to the District Advisory Council at their regular meeting next week. That is in the revised code that we have to present that to the DAC, again, District Advisory Council. So I'll be happy to entertain questions if we had a chance to take a look at it. I will try, and you can see, I mean, I know the directors know, I begged and pleaded for pictures and they delivered because I think pictures speak very loudly. And very intentional about, putting small chunks of language in here, numbers, pairing those up with pictures. I think it's something that people might be interested in reading. Hopefully you're one of those people.
Okay. We have item 6F before you. May I have a motion and second?
So moved.
Second.
Any questions? Ms. Hackathorn.
Dr. Gullidge,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Dr. Moore.
Yes. 6G, staffing changes. Ms. Hackathorn.
We do have, as you can see, we've had a couple resignations, but then also a new hire. So I'll turn that over to probably Emily first because she's got the couple resignations. So
Yes, so thank you. We recently had 2 resignations on our team over the last few weeks. First, our part-time breastfeeding peer, Victoria Smithson, ended her time with us on the 7th. Victoria was a joy to have on staff and always brought fun breastfeeding bulletin boards to life in the lobby. She provided our breastfeeding and prenatal moms with encouragement and support. And not long after Victoria's training concluded, she was our only breastfeeding peer on staff. And she stepped up to do her best to continue to support our community's families. Next, one of our only other senior health professional, Sarah Rickles, is resigning her position with us tomorrow. Sarah has been with the Clark County WIC program since 2008, before we were under the agency. She has been a constant staff member and leader for our new Carlisle clinic. And with her new position, she will continue to be a part of our WIC family, just in another county. Over the last 17 years, I've seen Sarah grow into a fantastic nutrition and breastfeeding professional. She will be greatly missed, and I know she will do amazing things in her new position. So I want to thank both Victoria and Sarah for their time with us, and I wish them both the best.
And then we were pleased to welcome Megan Landry. She just began her time with us on Monday. She's in a new position called Public Health Navigator. Primarily, her work we anticipate will come from the Community Health Connect Clinic. assisting people to get from our clinic into primary care and other referrals, like maybe dental or mental health or those sorts of things. So Megan was previously with the health department in Lori's programs, and then has some other had some other experiences in the last couple of years, and now is coming back. So we're happy to have her.
Thank you so very much. So we have motion 6G, a resolution appointing new employees for public health services as recommended by the health commissioner, hired from 3/3/2025 through 3/18/2025, and accepting their resignations of employees as submitted from 3/3/25 through 3/21/2025. Motion and second, please.
So moved.
Second,
All right, any questions? Ms. Hackathorn?
Mr. Griffith,
Yes.
Mr. Adamson,
yes.
Dr. Robinette,
Yes.
Dr. Moore,
Yes.
Dr. Gulich.
Yes.
Okay, financial report, expenses and vouchers. Ms. Moore?
Thank you, members of the board. In your packet for February, you will see all the bills that we paid and processed for February. If you have any questions, you can let us know.
Okay, I have a resolution to approve payment of bills.
So moved.
Second,
Are there any questions? We'll pay the bills. All right,
There's
Ms.
a lot.
Hackathorn?
Mr. Adamson,
yes.
Dr. Gulich,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Yes.
Okay, and we have no transfers. Monthly fund report.
Thank you, members of the board. In your packet, I've included the financial reports for February. If you have any questions, let me know.
Okay, that brings us to public health team reports, environmental health. Mr. Wood?
Thank you, Dr. Moore. So the license period for food facilities runs March 1st through March 1st. And we always send renewal applications out the last week of January. We almost always have in every program that we do, some operators who require a little extra effort on our part to get them to submit their license renewals and applications. We typically issue about 600 to 700 food licenses. This is not including our mobile units. And we reach out to them with phone calls before the end of February, trying to remind them that, hey, it's about time, we haven't received your renewal yet. Get it in before March 1st, otherwise you're gonna have a late fee. Just because, try to save them that little bit of extra money. Despite our efforts, we had 50 this year that were late. After the beginning of March, our environmental health staff went out to all 50 of those facilities to hand deliver an application and a letter stating, hey, you haven't renewed your food license. We need you to do that as soon as possible. That's more in. We still had some outstanding even after that. So I called them all as a reminder, hey, we need to get these done. If you don't, you're currently operating without a food license and your facility can be shut down. A few more came in. As of this week, beginning of this week, we had 9 that were still outstanding. So I had the pleasure of calling around to all of them, hand delivering a letter stating you're in violation of Ohio law. And now I'm putting this nice red placard on your door that says you're closed until you renew your food license, which, not surprisingly, motivated most of them to get in and either, some said, what can I do so you do not hang that on my door? And I said, you can pay me right now. And 2 of them did. As of today, there is one that's still outstanding. Right before the board meeting, I was able to finally get a hold of him, and he said, I'm not open, I'm not operating, I don't know when I'm going to open. And I said, okay. So He is going to figure out that maybe he wants to operate more like a seasonal and only work open 6 months out of the year versus all year round. So I'm going to work with him on getting his license renewed. But thankfully, with a little extra motivation this week, we have all of our food facilities licensed. And then last week, ODH, the Ohio Department of Health, was here to survey our sewage program. This is the first sewage program survey that we've had since the rules went into effect in 2015. While we know we have a lot of work to do in our sewage program to get it where it needs to be, we're, for the most part, from what they told us, we're doing a great job and meeting the requirements of the rules. So we do know that we will have a couple action plans that we're going to have to write for that, one of which is updating our cost methodology for our sewage fees, which I knew needed to be done. It could be 2 to 3 months or longer for us to get that actual report from the state. They're going through a lot of changes in their employees right now. So it typically takes 2 to 3 months, if not more. So I envision it taking a little bit longer for us to get our actual report back that tells us everything that we need to do. But in the meantime, we're going to continue to provide the quality work that we have been providing in our sewage program and make the improvements that we already knew we needed to make. We're going to start implementing those as we go. That's all I have for you tonight.
Thank you very much. You said that there were 600 to 700 food licenses, but that did not include mobile.
That does not include our mobile.
How many mobile do we have?
About 100 and I'd say between 125 and 150. A lot.
And when do they have to have their license?
So they just have to renew their license prior to them operating for the year. A lot of them, we send those renewals out the same time that we send all the rest of them at the end of January. A lot of them have already been sending them back with their payment. A ton of them have already scheduled because mobiles tend to try and operate all year round now. Mobiles have really grown and become a popular thing. When I started here, we had less than probably 100 mobile food facilities, and 10 years later, we're probably pushing, like I said, 150 ballpark. So the staff have been very busy getting out and inspecting those mobiles so they can be out operating.
Thank you.
You're welcome.
Nursing and clinics, Christine?
Yes, thank you.
Okay.
We have been doing well in all the programs. Reproductive health right now is very busy. Their grant year ends at the end of March. So they're looking at numbers and encounter numbers and working very hard to get those so that we meet the predicted amount of visits that we said we would do. Some of those visits can be done in screenings, and so we have done a number of different outreaches over the last, 6 weeks or so to try to get some of those screenings to count for encounters. So you'll see a pretty big number the next week or next month on the report, knowing that some of those are screenings that can count as encounters as well. So very thankful for the staff's dedication to their clients and also to that clinic. Also, Faith Community Health Ministry, as you saw the last page of the nursing report, they had a really great response. It was centered on the Catholic churches. They used some of the stipend money that they get for being a participatory church to hold a women's retreat, which the attendance was way over what they expected, close to 100 women, and just focused on wellness. So that was really a success for that program. And then the other thing is just working with the school nurses. We sent a couple communications just about vaccine rates and trying to encourage earlier back to school. Like if the school nurses could, prompt their students and their parents to come in a little earlier, because right now we do have still assistance of the ProLink staff that ODH is supporting. And we know that that will come to an end during the summer. So just feeling like this is a good opportunity to get families to get in. So of course, if you help us with that messaging, that would be great. So thank you.
Thank you very much. Any questions? Early childhood, Ms. Lambert?
Yes, thank you. I included a picture this month on my report of Sarita and Elena. And this is a demonstration of our infant to work policy. And this is the second Help Me Grow mom that I've had that's taken advantage of this, but she's done it the longest. And she was actually really anxious to get back to work because she knew she could bring her baby, she could continue to establish her milk supply. She would bring her in the morning to the office, and then she would drop her to the babysitter in the afternoon on her way to visits. She said that the families that she visited and her friends were amazed that CCCHD had such a policy, and many moms shared that they want to work someplace like ours, a place that doesn't just talk about the importance of supporting attachment and bonding, but has a policy that supports it. If Sarita needed to step away from the baby, she had all these people that were right there ready to, swoop her up. And in fact, you had to have part of the policy is that you have backup person. So if you have to step away, you have a backup person. She had plenty of those. Sarita shared, I asked her, but how it affected her. And she said that being able to bring the baby to work was a tremendous help for a young mom. It's also significant to mention that we first met Sarita as a Help Me Grow mom, that we visited her with her first baby, and then she was able to do the training to become a credentialed home visitor. And Sarita is from Peru, and as such, she's fluent in Spanish. So she's able to complete her training. She was able to complete her training, and we have the curriculum in Spanish and English. And so all the families that she serves are Spanish-speaking parents. So she joined us from about several hours a week from about a month to her 6th month, and sadly, or gladly, she turned 6 months in February, so she can't come anymore. Because once you start crawling around, then, it becomes a little bit dangerous. But she just wanted to have me thank the board for having such a policy to support that early attachment. So, thank you.
Thanks for sharing.
Yes. Very nice. Any questions? Women, infant, and children, Ms. Schaefer.
Thank you, Dr. Moore. You will notice on the activity report that the WIC and Springfield Regional Medical Center visits are included now. This may morph over the next few months as we look at the data, but we did see a total of 54 participants getting them certified on the program, and that's mom and babies. And that was during 10 days that our contract dietitian was available at the hospital to do those visits. And right now, the breastfeeding rate is 59%. I know, looking at the stats that she's been sending this month, that's already been increasing. So this has been a great venture, and we look forward to those rates improving. And then next, March is National Nutrition Month. And Ohio WIC's theme for this year is Reduce Food Waste. To celebrate, participants visiting the office this month are receiving a reusable goodie bag, My Plate, and Dip It Bowl. Lori, do you mind passing that around? And it has a tip sheet that talks about reducing, reusing, and repurposing items that also include recipes and just activities that parents can do at home. Such as an egg carton nursery, making that, and a bird feeder out of a orange peel, which is kind of neat. And then we also last week celebrated our nutritionist on staff through the agency social media accounts for National Registered Dietitian Nutritionist Day and National Nutrition and Dietetics Technicians Registered Day. It's a mouthful. And our staff also participated in, our state has been having annual nutrition conferences, so we were able to participate in that this week, which the staff loved. They were such great speakers and relevant topics, so everyone enjoyed that. Lastly, with Sarah's departure, Chris and I have reluctantly decided to pause temporarily our operations in New Carlisle just because of our open positions and with how long it does take to train staff. So at this time, we are pausing those operations in New Carlisle to help inform our participants about the temporary closure. We have been, I sent a text message out to alert our participants, and they've gotten a flyer this past week. And to help keep them a part of our programming in our county, we're moving their appointments to our Springfield office right now, at least giving them that option. So the appointments they already have scheduled, they'll keep those, but come to Springfield. And we're providing a free gift with their first visit at Springfield to help kind of encourage that
So how many
visit.
people from New Carlisle are participants?
It's about 400.
Wow, that's a lot.
Yeah.
It is.
Are there any transportation issues with any of them?
I have gotten some feedback of that being a concern, so we're definitely keeping that in mind. We have had, I know of at least one participant that is going to be transferring to Montgomery County, so I know we'll have some of that, some of our participants going to our surrounding counties.
You said it was temporary. How long do we estimate that temporary closure might be?
So we're not 100% sure, but right now we are estimating about 60 days.
Oh, it's based on staff.
Yeah.
Right.
Yeah, hiring.
Montgomery is much closer for them.
Some of them, some people are
Depending on where they
coming.
live.
Supposed to throw
Yeah.
them something.
Tip City and Vandalia, we have participants from those locations. Yeah, Beaver Heights.
There might be actually a closer location than coming to Springfield.
Yeah.
Yeah, correct me if I'm wrong, when we say 400, that's not necessarily 400 Clark County residents going.
Right, yes.
That's 400
Yeah.
participants
That we
coming
Coming into
from
the-
even other areas
Yes.
to our Clark County. or-
Gotcha,
Thank
okay,
Carlisle
so
location.
from other counties even.
Some
Yeah.
from, for sure.
Okay, thank you.
Any additional questions? Health planning. Ms. Hemphill.
Yes, hello, thank you. You have the health planning report in front of you. There's just two things that I wanted to point out, to make your, bring your awareness to. The first is within our drug overdose and substance abuse program. There are pictures of what look like purple newsstands, like old, newspaper stands. Those are actually, designed to hold naloxone or Narcan in them. So we are kind of piloting these. We're gonna put them one out front here, and then at Southern Village at our location, we're gonna work with McKinley Hall, who is our county's Project Dawn site, to get the Narcan in there. And it's free Narcan. Anyone can come and take it. No demographics or paperwork will be needed to be filled out for that. So it just goes with, having access to Narcan, and that's one of our biggest strategies with our drug overdose prevention program as a community. So we're excited to have those. It's something new to try, and we will see how it goes. And then the other thing I wanted to point out is within tobacco. So last month at the meeting, Leah Baylor, who is our tobacco grant coordinator, presented on the tobacco beer retailer license, gave an update, kind of what we were thinking about. And really, since that meeting, she's been on tour, both locally and at the state level. So Leah was asked to present at the State House for their budget hearings at both the Health and Finance Committee to talk about local impacts of state policy and budgeting that is needed to help make these programs go. So there's pictures of her in action there. And then her and Chris spoke at the March 11th City Commission meeting at a work session, talking about the updates, doing a very similar presentation that she did here. All of it has had really good feedback. Her show and tell, I think it makes the biggest impact, as you remember the tub and the vapes. But Leah does a great job, so I just wanted to shout her out and let you know that the work being done here in Clark County is being seen locally, but also on the state level.
Thank you.
Very nice. Any questions?
I mean, I think I said this last year before, I'm not a big fan of the naloxone. I just think you're just encouraging poor behavior. I would rather work at it from a behavioral stance. It's just like, quit smoking, but here's some matches to light your cigarette. That's just kind of my opinion. I think that it would be better to work on the source of why they're having these issues, but just my
I'll
thoughts.
offer, we do that too.
Yeah, I know, but it's just like, here you go.
Until
Go
they're
grab
ready.
a couple for your party.
Until they're ready to make that decision and enter treatment, we want to save their lives. That's the reason we do work from both angles of that.
Yeah, but well, if there's consequences for poor decisions though, that might be more of an incentive too. So, another way to view it.
Any other questions or comments? I do have a question. So do we have any other grant opportunities for getting medications that we can provide to the public? Like I'm thinking EpiPens.
Yeah, I'd rather see EpiPen boxes than.
I'm just
naloxone.
asking because I know that that's a real expense for our folks, and I was just wondering, what do you think?
Great idea.
Mm,
I haven't seen any
Yeah.
grant opportunities for that, and we would watch every possible
okay,
new grant opportunity.
okay.
With prescriptions, I don't know.
I just know that I know people who have them and they have expired.
Mhm.
And I'm like, it's such a great expense to them, so just wondering. Okay. All right. Let's see here, legislative updates.
That's me.
Yes.
So I want to underscore,
Wait,
I'm good. I was waiting for my name, but okay.
Mr. Cook.
I want to underscore what Gracie said about Leah. I got a chance to see her in front of the State House Health and Finance Committee. If you're interested in watching that, I mean, you can Google search for that. She did a great job. A lot of times they have a very compressed amount of time that they're allowed to speak. And on her first episode, she jokingly says Leah goes to Capitol Hill, and it's funny when she says it. She got up there. She thought she had how many
5
minutes?
minutes.
5 minutes, and they told her, "Just kidding, we're
Yeah, as she
running
was walking
behind.
up, you get 3 minutes.
You got 3 minutes." And she had 5 minutes worth of stuff. She had practiced, and so she felt like a speed reader. But she got it all done. She did a great job. She got invited back to go to that second committee, and I think she did a great job at the city commission meeting too. So she has a very calm, cool, collected presence. You heard her in here. I think she just did a fantastic job, and so she should be very well commended for that. So in the other realm of legislation, at the state level, there's just a few House bills, Senate bills I want you to be aware of. I mentioned a couple of them before. One of them being House Bill 28, which would eliminate the authority for municipalities to do a replacement levy. So what that leaves municipalities with is renewals and renewal plus additional. Replacement levies are the only way that we can try to catch up to inflation. That's what we did last time. When you have renewals, they stay at old property values. And the only way, again, inflation happens. We know that a medication, a vaccine, a test strip for our restaurant, they don't cost the same as they did 10 years ago, 5 years ago. And so if we're not able to do replacement levies, municipalities, again, not just health departments, I'm not sure exactly how we're going to be able to have the same purchasing power in 5 years or 10 years. We'd have to go to voters and say, we need a renewal plus additional. I don't know about you, but when you see additional, that just, first of all, you lose a lot of people right there with that word. I'm concerned because it has gone through House committee. It's been passed by the House. Association of Ohio Health Commissioners provided testimony this week, along with a bunch of other municipalities and representation, saying this is a bad idea. The premise is the that we don't think voters understand what a replacement levy does. And so AOHC has offered, well, if that's the case, then let's find another solution. Let's not take the tool away. Let's find a better way to make sure people understand what that tool is. So I don't know where this is going to end up, but it would affect a lot more than just health departments. It would affect a lot of municipalities. Anything you see on the ballot that's a levy, suddenly you can't do a replacement levy. So that affects a lot. Fire, EMS, other municipal corporations, subdivisions of the state. So I'm very, very carefully watching that. Again, AOHC is strongly opposing and provided testimony this week. House Bill 137 would change a couple of things in the law specific to health departments and public libraries. The way things are written right now is when we want to do a levy renewal, hopefully a replacement as well at some point, the county commissioners have to receive that request from us. And the way the law is written right now, because we are an independent political subdivision of the state, they have to say, yeah, okay, it's kind of a pass-through. But the way the law is written, they have to just say, okay, health department wants it, they're an independent subdivision of the state, we pass it through. This would actually change it so they could say no, which is really interesting. The intention behind this, if you look at the primary sponsor behind this, he said it was never to hurt health departments in this way. It was to correct a situation that happened with a public library and how they mishandled their levy request. It's very isolated on targeting this one library, but it would have very broad stroke across health departments and libraries if they change this one little bit of the law. I mean, we're talking about changing a couple words from shall to may. That is really what it's doing. So we're providing, this may not go anywhere. Again, when we look at this kind of stuff, we look and say, okay, we talk to the primary bill sponsor and say, how can we achieve in some other way what you want to achieve? Is there another way that we can accomplish this? And so we were going to provide testimony on this so that while I think we have a great relationship with our county commissioners here, there are other health departments. There's more than 50 health departments that rely on the levy across Ohio. And some of them, maybe they don't have the best relationship with their county commissioners, and they would find a reason to say, no, you can't have your levy. Again, my concern isn't here, it's the broad public health picture across Ohio. So we're keeping a close eye on that one as well. House Bill 57 changes some things, and this is really on the fringes of public health, how schools have to develop policies for administering Narcan and naloxone or making it available in schools. Basically says that they have to have policies behind how often thhere going to replace it, what schools are going to have it in, that who can be trained, who needs to be trained to be able to administer it. There's a lot of schools that just choose to have it. This puts in policies that you have to have certain things written and accepted by your Board of Education. So again, on the fringe, it doesn't really directly affect us, but because it's in the arena of prevention where we work, we're kind of paying attention to it. We're not taking a position on this bill from AOHC standpoint. We're just watching it. Schools, I don't know how they feel about it. I've got a couple of feelers out, but it's just in House Committee right now. There's no imminent action on this one. The last one, just learned about this one. I don't have a lot of information for you, but Senate Bill 78, I'm just going to read the title of it. Establish and operate the Ohio Healthcare Plan. It's basically universal healthcare in Ohio. And we're in it because it creates 7 regions in the state, and each region has basically a committee. And those committees select a person from every county and region to represent them on a panel that advises the development of this Ohio healthcare plan. Guess who they said is going to represent and select those people? Health commissioners from every county in those regions. So don't ask me questions on this because I guarantee I don't have the answers. I have this and I haven't made my way through it yet. I really would be surprised if this gains any traction. Not a lot of co-sponsors on this one. I don't even know the primary sponsor. I don't know Paula Hicks Hudson. I don't know what area of Ohio she represents. But this is very much new. So my hope is to have more information to share with you next month on where this might go. So don't ask me questions.
Any questions?
Wait, hang on, I got one more thing. Hang on.
Just one more question.
You remember how long last month was?
Yeah.
We're not gonna do that. All right, so I want to leave you, I guess, really with a thanks to people sitting next to me. I know I do this often, but I mean it. In the absence, actually, everybody down here, in the absence of a second fiscal officer, and as we're pursuing our first director of finance, we've had to pick up, for a whole position, really. So Linda, thank you. I know you've done a lot for us in the last few weeks. Gracie, Shannon have done a lot too. Thank you to the directors for being patient while we kind of felt our way through some of these things. We had some good notes left for us, but we've had to kind of figure some stuff out ourselves. But you see everybody on the side, they've been very instrumental in making that happen. As we are pursuing that first ever director of finance, things are going well there. I don't have anything new for you, don't have a name for you, anything like that, but we've got some very strong candidates that we're looking at. So, now.
Thank you so very much, Doctor. I do just want to say this, because we had a health fair at St. John Missionary Baptist Church, and the Clark County Combined District showed up and showed out. They always come and do a very, very nice job, and so we're so very appreciative of the work that you do. I'm always very proud to say that, yeah, I know them. All right, so I just wanted to give a kudos to you guys. Okay. All right, additional business. Oh, sorry, I jumped over this. We need to move into executive session. Okay, so I need a,
You want to state the purpose?
yes,
Sorry.
I'm getting ready to go there. Okay. Motion to enter into executive session for the purposes of considering a dismissal of a public employee. So I will need a motion in a second.
So the second.
Ms. Hackathorn.
Wait.
Oh,
Do you want to read them? Sorry, Dr. Moore. Do you want to read the rest of that before the roll call vote?
before roll call vote, explain that the only business that will be conducted after the executive session is to adjourn the board meeting. Now we can do a roll call. Okay.
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Dr. Gullidge.
Okay.